Welcome to this video. In this video I will talk about malabsorption syndromes. So what is malabsorption? Malabsorption means there is an abnormal absorption of the nutrients from the GI tract, okay, which occurs because of so many reasons. Now because of this malabsorption, what will happen is food will not be absorbed and it will pass out in the stool, okay. And there is a characteristic stool that is passed in malabsorption syndrome, that is fat, bulky, foul smelling stool, okay. It occurs because of there is increased fatty acids present in the stool because it is not absorbed from the GM mucosa, and this fatty substances and the carbohydrates will be digested by the bacteria which will be present in the colon, and this will this will lead to bloating. This will lead to foul smelling stools, okay. So patient will experience this bulky foul smelling stool, and also there is flatulence, indigestion, bloating, and this will with time this will lead to indigestion, loss of nutrients from the body, and patient will experience fatigue, patient will have anemia, patient will have vitamin deficiency, and patient will become physically weak. And because of all this, basically his socioeconomic life will be affected, okay. So how to approach this type of patient? So first of all, what are the causes? Celiac disease, tropical sprue, Whipple's disease, pancreatic insufficiency, and lactose intolerance, okay. So celiac disease and tropical sprue I have explained in my other video. So in this video I will talk about Whipple's, pancreatic insufficiency, and lactose intolerance. So let's get started. First of all, what is Whipple's disease? Whipple is caused by Trophilema whipplei. This is a bacteria, okay, and this is intracellular, okay. So this will live inside the cell. What happens is, when this take this is the intestine, okay. When this bacteria enters, this will enter the lamina propria. In the lamina propria we will have the macrophages, okay. So this will be engulfed by our macrophages, and this will be taken to the lymph nodes, and in this way it will enter the system, the systemic invasion. Then what this will do is, this will cause CNS symptoms, cardiac symptoms, okay, and joint pain. Initial symptoms, mostly these are the symptoms. Then with time, as a patient becomes old, okay, there will be increased inflammation in the GI mucosa, and this will affect the epithelial cells, okay, and there will be blunting of the villi. It will destroy the epithelial lining, and this all leads to malabsorption. Okay, so with time malabsorption is developed. First these symptoms will be formed, then malabsorption symptoms. So because of the engulfment, okay, by the macrophages, when we take the biopsy of jejunum, what we will see is this pass positive macrophages. Why these are pass positive? Because the macrophages has engulfed the bacteria, okay, Trophilema whipplei, and this stains pass positive. That's why this is written that pass positive for me macrophages, okay. This will enter mesenteric nodes. This cardiac arthralgias and neurologic symptoms will be formed, and later diarrhea and steatorrhea. So treatment is antibiotics, okay. Here we will give tetracycline. What is the treatment? Tetracycline, right? Now we will talk about lactose intolerance, okay. Imagine this is our intestinal cell, okay. There is this lactase enzyme, okay. We are talking about lactose intolerance, right? So what this lactase enzyme will do, it will help in converting lactose. So what happens is, whenever there is an insult to the GI lining. Okay, like when there is a viral enteritis. Okay, in children, mostly this is seen in children. It can also be seen in adults, but mostly children. So what happens is, if there is a viral enteritis, okay, so this virus will destroy the villi. So what will happen? The cell will become like this. So absorptive surface decreases and there is a loss of this lactase enzyme. So here at this point of moment, patient will experience malabsorption and lactose intolerance. So when these children drinks milk, they will experience indigestion, bloating, and passage of more and more bulky stools. Okay, so it seems like the patient is not recovered from his basic viral enteritis, but it's not like that. uh, the virus has been cleared out, but because of the destruction which is caused by the virus, there's a blunting of the villi, and now there will be decreased absorption. Now with time, within a week or two, again villi will start form, and the patient will be normal again. So during this time, what we need to do is, there is no need of antibiotics here, but mainly we need to give supportive treatment. Okay, and we should avoid milk during, or other dairy products, lactose containing substances. Okay, we need to avoid. Now we have pancreatic insufficiency. Pancreatic insufficiency. So we all know that this is our stomach, this is duodenum. Okay, here we have our pancreas, this is a pancreatic duct. Okay, now the secretions are released from here to here, to the duodenum. So pancreatic enzymes, now these pancreatic enzymes are essential for the digestion of the food. If there is a insult to this pancreas, or if this pancreatic duct, then what will happen? This pancreatic enzyme won't be released, and there will be no digestion of the food, and this will lead to malabsorption. So now from this, you can find out the causes of pancreatic insufficiency if there is a chronic pancreatitis, right? Cystic fibrosis. Cystic fibrosis. So this all causes pancreatic insufficiency. So in this way, we have this most common causes of malabsorption syndromes. And also we can diagnose this lactose intolerance. Diagnosis of lactose intolerance is by hydrogen breath test. Hydrogen breath test. This will be positive in this patient. So yeah, that's all for this video.